Causing some shockwaves and concerns internationally. We're talking about the Zika virus, and of course, the World Health Organization has declared it a global health emergency. So what does that mean to you, your family? Are you traveling? Do you have plans? Well, Dr. Marcy Maguire from Reproductive Medicine Associates of New Jersey and Christine Gorman from Scientific American health editor is here, is the health editor and contributor. How are you guys? So I see the Zika virus. I see everything that the World Health Organization has put out, and it's so alarming. What do we need to know about this?
There are some significant health concerns with regard to the Zika virus. In terms of infections in adults, only about 1 in 5 patients will exhibit symptoms. They tend to be mild, fever, chills, rash, red eyes or conjunctivitis. But the more significant concern is related to pregnant women. Yeah. And so there appears to be a connection with pregnant women transmitting this virus to their children and the children being born with microcephaly. Right.
So microcephaly is a birth defect where the child is actually born with a smaller head, and it has all sorts of issues as a result of this disorder. But can I ask you a question? The last time the WHO, the World Health Organization, declared this sort of emergency was because of Ebola. Right. Are we at this stage, and I hear terms like pandemic, you know, these are words that are very scary for all of us, and especially because it's here in New York. People have traveled to those hot zones that the World Health Organization put out there. So what do we need to know?
Well, there is some thought that the WHO declared a pandemic, declared an emergency because they were caught so flat-footed with Ebola. Mm-hmm. I wouldn't say that this rises to the level of an Ebola crisis.
Okay.
It's something new, however. Zika has not been in the Western Hemisphere before, so no one has immunity.
Zika, just a little history. I mean, these are some of the countries: Barbados, Bolivia, Brazil, Cape Verde, Colombia, Dominican Republic, Ecuador, El Salvador, French Guiana, Guadeloupe, Guatemala, Guyana, Haiti, Honduras, Martinique. I mean, Mexico, Panama, Paraguay, Puerto Rico, St. Martin. I mean, it goes on. U.S. Virgin Islands. It seems like
it will be throughout Americas except for Canada and Chile because of the mosquito involved.
Because of mosquito involved. I know airlines are starting to spray. I think there's going to be some spraying that's going to be done in these countries as well.
You can't stop the mosquito, though. Aedes aegypti, the name of the mosquito, is a mosquito that is evolved with people. So wherever people go, this mosquito is with them. We have it in the United States, primarily in Florida and the Gulf Coast.
Okay, so it's already here. Is that what you're saying?
The mosquito is here, so chances are the virus will be here soon.
Okay, so what does that mean? Because you're saying that the mosquito is already here in Florida. We don't have a vaccine. We know that
we won't have a vaccine for at least 10 years. Yeah.
Birth defects.
We don't know for sure it's connected with birth defects. The circumstantial evidence is pretty strong. Even in cases of microcephaly, and correct me if I'm wrong, about 15% of the time you have normal intelligence. So microcephaly just refers to measurement of the circumference of the head.
Okay.
So, but the thing, you know, we used to have malaria in the United States, and screens on windows and doors kept the mosquitoes out. There are all kinds of things you can do. I think probably this is one of those situations where, you know, regular mosquito.
Okay. So women who travel, I mean, this is a major concern for them, really, if you're going into these hot zone areas, right?
Yes, and actually a number of my patients have asked, should we cancel our plans to the Caribbean, et cetera. Right. And at Reproductive Medicine Associates of New Jersey, we are saying, yes, please do cancel your trips.
If you are pregnant.
Or anticipating pregnancy through in vitro fertilization or other means, you should cancel your trips, or upon returning, wait at least a month after the return from the trip to attempt a pregnancy.
Midwinter recess is next week. A lot of parents have made plans to go on vacation. What if they're not pregnant? What if they have young children? Should they be concerned?
So not to the best of my knowledge, the symptoms in young children are similar to those in adults, just mild symptoms, fever, chills, etc.
Okay. I mean, there's so much to discuss about this, and we're going to still break down some of the travel risks, because I think a lot of people want to know what are airlines doing, what are hotels doing, because they are accommodating people, because the fear is very real. And with the World Health Organization putting out this emergency, a lot of people are talking about this. So we'll talk about trips to the Zika-infested countries who are in that hot zone area that we ran off for you, and find out how you can protect your family.